We're here at the 21st CROI in Boston, and we're here talking to a community educator who got a scholarship to come to the conference, and his name is Mupeli, and he is from Botswana. We appreciate you taking the time to be with us and to discuss some of the issues that you're facing in your country. So tell us about the organization that you represent.
Yes, I'm representing Center for Youth of Hope. It's an organization that was established way back in 2002. Mm-hmm. It's primarily target young people living with HIV and AIDS. Mm-hmm. So we provide them with health life skills, prevention of HIV messages, and how they can generally live positively with HIV infection.
Mm-hmm. So you teach about how to live with the disease as well as how to prevent the disease.
Yes.
And sometimes they're inextricably connected.
Yeah.
Because people who are on treatment are probably going to actually be preventing other infections.
In fact, that's the point that we emphasize on, that there have been a lot of studies that have been done that point to the fact that treatment itself is prevention. And we trying to not only talk about the importance of getting into treatment, but also the importance of adhering to treatment. Mm-hmm. So, you know, we dealing with young people and they have different challenges. Adolescents facing stigma in the community, and that also challenges them as far as adherence of treatment is concerned. So we give them skills, we give them stigma, fighting skills, how they can confront stigma, how they can live in a community with a high rate, not only the high rate of HIV prevalence, but also the high rate of stigma attached to HIV and AIDS. Yeah.
And how do you do you see that going? Is the stigma seeming to get better, or can you deal with it better, or is it getting worse, or does it go up and down, or how would you describe that over time?
I think basically it depends on from which angle are you looking at the stigma. Mm-hmm. Some people are saying, well, if people are accessing treatment in an open ARV clinic, it means that alone indicates that perhaps the stigma levels are going down. Mm-hmm. But I think, to me, stigma is still there. People are not openly talking about the HIV positive infection. Mm-hmm. There are few of us. For example, I'm HIV positive. I've been living with HIV for the past 15 years, knowingly, that is, but I don't know exactly when I was infected. Right. I'm on treatment. So when I talk to young people about the importance of staying on treatment, the importance of looking at their own health rather than looking at what other people around them will view them to be, that's what they should actually put their effort on. Live positively, develop your own self-esteem, know that you are able to live just like any other child, any other youth out there who is
just happen to be HIV.
Yes.
Yeah. And you talked about self-esteem. It's really a large part of what you do. Yeah. Do you work with support groups or buddy programs or community? I mean, the group itself is probably very supportive, but are there other support groups? Or I mean, it seems like your population, a very large % of your population is HIV infected.
Yes.
So it's a little different than in our country.
Yeah.
We're very much in the minority.
Yeah.
But also some of the challenges around females. Can you address those? Because females have a lot more problems with, they have a family, they have to take care of the kids, and they have to take the treatments, they have to get the tests, to check where they're at. How do you see that as an extra challenge maybe for females?
Yes, I mean, I come from a country where females are actually, to a large extent, viewed as vectors of the disease. So generally people think that women actually transmit HIV, and my own perception, that is to the contrary, it would be us men.
Mm-hmm.
But
Mm-hmm.
but all the burden of stigma actually piles on women.
Mm-hmm.
But what we emphasize in our program is that we have a family care model where
Mm-hmm.
we do not only look at this young person living with HIV and AIDS,
Mm-hmm.
we look at the family that the young people, the immediate members of his or her family,
Mm-hmm.
and just the people around our client, so that that's the only way we can promote adherence,
Mm-hmm.
for example. And we give them a lot of skills. They know what stigma is. They know in what form it manifests itself. They all know all these things. But really there's a lot to do because of other cultural, social, economic
Mm-hmm.
issues
Mm-hmm.
that still, promote stigma itself.
Mm-hmm.
Other religious issues.
I think we know that stigma is not going to go away. It's just
Mm-hmm.
how can we make it less prevalent or less emphatic, make it less obvious. And I think the more we become normalized, it's an exceptionally difficult disease, but it's also something we should try to normalize as much as possible. Do you have other programs like exercise and nutrition and things like that you try to get out to the people, because it is more important, I guess, to become more active, to become more conscious of what you eat and so forth?
You mean among our members?
Among your members?
Yes, we encourage that. And we're dealing with young people. And we definitely do wellness. We have wellness program where we do not only talk about good nutrition, also talk about how they can physically keep fit and both physically and mentally. And it's not due to lack of funds. We wanted to actually come up with a space in the community where we can actually maybe put up a structure where we can have various forms of indoor sports and a gym, so that they can also
community center or civic center or something like that.
Yeah, so that young people can actually come in and access those services.
Would that be for everyone, or would it just be for specific?
Because of stigma, we may.
Yeah, it might be a good way to bridge that gap.
Yeah, we may not restrict it really to.
Yeah, exactly.
To our members only. Perhaps we would say, okay, because of stigma, if we say this service is exclusively.
So everybody that's there is positive.
Yeah. We know that. Oh wow, we've seen you. You are walking into that.
But it would be a good thing. And then the other thing is, do you educate on? I guess the big question is, are you doing anything with PrEP, and is that something that's going to be investigated in your community, pre-exposure prophylaxis? Is there any of that going down?
Unfortunately, no.
But they're using condoms. They have condoms.
We are with PrEP. We not really
investigationally or anything like that.
Yes, we are not doing anything about it. But during our treatment literacy, trainings for the youth, they know what PrEP is.
Oh, okay.
They understand it.
But at some point, it might be that you could get some sort of a demonstration project going there, so you could demonstrate its benefits. So,
especially now, you are right, boss. Especially now that these are young people who are now getting into adulthood, they may actually now find partners. Maybe HIV negative partners.
Yeah, and that would be
PrEP
perfect. Yeah.
is a very, very, very good thing that they should be able to know at this point in time.
Right. Well, is there anything else that you'd want to bring up here that would be important to enlighten our audience about the challenges that you face, and also the things that are moving in the right direction?
Yes, I think the only thing that I should actually would like to take this opportunity to highlight is the fact that we would want to network at global level with organizations here in the US and outside Africa, and see how we can do some exchange visits and learn from other groups and see how they are managing, you know, groups of young people living with HIV and AIDS. We want to know more about how other people are doing it.
Within the continent there as well as outside?
Yeah, within Africa and as well as outside Africa.
Well, you know, the way we can do that is you can give us, you can actually say, do you have a website or something?
We have a website.
A blog
that you
site
can,
or
at least you can, it's a free website, it's a WordPress.
Okay, that's
website,
fine.
but you can
Well, give it to us now, and then we can put it on the bottom of our description of the program here we're doing.
Yeah.
And do you want to give that over the?
Yes, I'll give that.
I mean, can you say it now? Or?
It's Ceyoho, CEYOHO .wordpress.com.
Okay, so they can contact you there. We'll also put it on the description, like I said.
We are also on Facebook. You can just Google Ceyoho, then our Facebook. Like us on Facebook, then we'll be able to.
Right, and it's important, I think, like you're saying, networking is important because somebody learns something and they can say, oh, we could do that too. And we can improve our community because of that or this or whatever. There's a resource that you could use because networking is enormous. And now with the internet, everybody can be connected in a matter of a second. Kennedy, I really appreciate your time with me.
Thank you very much.
Thank you.
You're welcome. Thank you.